Now I'd like to introduce Dr. Jeremy Hess, the Director for the Center for Health and the Global Environment at the University of Washington in Seattle. Dr. Hess is a global report author and a senior author of the U.S. Policy Brief. Over to you, Dr. Hess.
Thank you, Cerily and Ian. It's my pleasure to talk with you this morning about the intersections between the global report and the U.S. brief. As Dr. Hamilton noted, climate change is a global challenge. We all bear some responsibility for the problem, though certain countries have contributed much more than others historically. The impacts are global as well. The Lancet Countdown on Health and Climate Change lays out the global landscape for these impacts on climate change and health, and tracks progress on a wide range of indicators of exposures, impacts, preparedness actions in the health sector, efforts to reduce emissions, and engagement by health professionals. I see it as the monitor at the patient's bedside, showing heart tracings and oxygen saturation. This is the report's 5th year, and it documents more worrisome impacts than ever before. The monitor's alarm bells are becoming increasingly insistent. The report documents that the carbon intensity of the world's energy system has remained constant for nearly 3 decades. We've seen increases in coal utilization for 2 years running, reversing a trend that started in 2013. There has been a 21% annual average growth in renewable energy capacity from 2010 to 2017, but the world is not on target to meet the targets outlined in the Paris Accords, and warming's increasing rapidly. The 5 hottest years on record have occurred since 2015, and as Ian noted, we are 1.2 degrees Celsius or 2.2 degrees Fahrenheit warmer than we were in the pre-industrial time. We're seeing impacts of climate change all around the world. The report documents increases in climate-sensitive hazards like heat waves, wildfires, and floods. And we're seeing impacts on people's health. Heat waves are particularly deadly for our elders. We've seen a 54% increase in heat-related mortality in people over age 65 in the past 20 years. And in 2018, that totaled 296,000 deaths. The warming's dangerous for our workers too. It reduces their productivity. It's particularly the case in hot places where a lot of people work outdoors, but we see impacts in cooler regions like the US as well. And we've seen an increase in wildfire exposure risk in 114 countries from 2001 to 2019. We certainly have seen that increase here in the US. Global yield potential for staple crops has declined from 1981 to 2019. And we're seeing clear, steady increases in climate sensitivity of infectious disease transmission since mid-century. These impacts are starting to stress our public health infrastructure. Nearly 70% of cities around the world expect climate change to seriously compromise their public health assets. We are seeing more signs of engagement in the health sector, as Ian noted. We've seen small increases in adaptation funding overall and small growth in adaptation spending in the health sector. 51 countries have developed plans for national health adaptation. Unfortunately, the United States is not one. We're seeing increasingly widespread and strenuous response from health professionals, which is great. There's more literature on climate change health impacts than ever before. And the health sector, which is responsible for 4% of emissions globally, is starting to make significant efforts to reduce its footprint. We in the health sector are making progress toward living our ethic of doing no harm. There's much to be done. The global report sets the stage for this year's US brief. The US is poised to re-engage with the world around climate change and hopefully around climate change and health.
My name is Zach Unger. I'm an Oakland firefighter and president of the Oakland Firefighters Union. When I started as a firefighter almost 25 years ago, we used to talk about wildland season. But now with climate change, wildland means everywhere and there's no season anymore. We used to count on being done by October, but lately we've been fighting fires all the way up to New Year's Day. California firefighters now routinely spend all summer and fall bouncing around the state from fire to fire to fire. My scheduled work week is 52 hours, but I haven't worked fewer than 120 hours in the last 4 months in any week. Climate change means that my members are always at risk. My communities are always at risk. This job is growing unsustainably more dangerous every year because of climate change. As I sit here in my air-conditioned union hall, 2 of our brothers from Orange County are lying in the ICU right now, covered in third-degree burns, being breathed for by ventilators. They were overtaken by a fast-moving wildfire last week. I worked the Santa Rosa fires in 2017. That was 25 people dead and 5,000 homes destroyed. That wasn't a cabin in the woods. That was a full-on city. Even when we're not on wildfires, we are inundated with the smoke from them throughout the West. We talk about smoke season like it's this fact of life, like, oh, October, you're not going to be able to breathe. But this summer, we had 30 straight days of unhealthy air in Oakland. Oakland already has one of the highest rates of asthma nationwide, and our kids are really suffering. If we don't do something about climate change, I don't see how we, as firefighters, can live up to the oath we take to protect the most vulnerable in our communities. You know, wildfires aren't theoretical for us. It's not a policy debate. It's our brothers and sisters literally fighting for our lives out there. When I started on this job, we could spend more time on proactive, preventative measures. We're paramedics in addition to being firefighters. We're healthcare professionals. And I am so hopeful that we can get back to a time when we respond to day-to-day emergencies rather than large-scale, era-defining catastrophes.
Good afternoon. Thank you for having me. There's a lot to reflect upon from 2020 as the pandemic brought us together in shared suffering and loss. Just like a stress test for the heart is used to reveal the problematic artery, so too has the pandemic been a stress test for the world, especially for the US. Both have revealed and exacerbated our problematic areas and clearly illustrated that our nation is not adequately prepared for global scale health challenges, including climate change. However, stress tests can be life-saving because they can allow the vessel to be fixed before causing a massive heart attack. Thus, the new 2020 Lancet Countdown on Health and Climate Change US brief can also be life-saving as it stresses where the problems are so we can start fixing them today. Our recommendations are a prescription for better health and a blueprint for decision makers. It's a clarion call from over 70 institutions, organizations, and centers working at the nexus of climate change and health in the US, and further highlights the urgent call from health professionals to implement sweeping climate action. For example, for older adults, 8 out of the 10 highest ranking years of heat wave exposure have occurred since 2010 in the US, and heat-related deaths reached a record high 19,000 in 2018 alone. Labor productivity is continuing to decrease due to extreme heat as 2 billion potential hours of labor were lost in 2019 just across 4 sectors. The risk of wildfire exposure is increasing, and the central US states suffered through widespread flooding events in 2019, as highlighted in one of our case studies. These indicators only brush the surface of the true health impacts. And the pandemic has shown on an accelerated scale that healthcare systems get overwhelmed when public health systems fail. We currently have inadequate investment in our public health infrastructure in the US and are far below the investments needed to prepare our health sector for climate change. Now, in my practice as an emergency medicine doctor, I can't take just one health problem and place it in isolation when treating a patient. One insult on the body creates new issues and worsens old ones, just like climate change. Thus, another key theme of the 2020 brief is the interconnected nature of our nation's most pressing health challenges and how climate change continues to underlie and exacerbate them with cascading and far-reaching failures. But this also means that there is an enormous opportunity to take an integrated approach when tackling these problems because addressing them holistically can have wide-ranging benefits. I'll highlight 2 of the wide-ranging benefits of climate action. First, climate change and air pollution have the same root cause, the burning of fossil fuels. More than 68,000 people died prematurely in the US from air pollution in 2018, and nearly 25,000 were from agricultural and transportation emissions. Thus, we can reduce disease and death from air pollution in the US today with climate action. Second, the pandemic and climate change are exacerbating health inequalities due to ongoing discriminatory practices stemming from systemic racism. Communities in urban areas that were historically redlined are almost universally hotter and more exposed to air pollution. And the underlying diseases from being plagued by decades of racist polluting likely explain in part the reason why Black, Indigenous, and other people of color are dying of COVID at rates more than twice that of white people. The pandemic is highlighting these underlying realities, but also shows how climate action is essential to bending our arc towards health equity and justice. Our prescription for health outlines 6 key recommendations. First, agriculture must be part of the climate solution through sustainable practices that reduce pollution and greenhouse gases. Second, how a country spends its money reflects its underlying priorities. We have to eliminate subsidies that lock in fossil fuel exploration and production and effectively finance the downstream adverse health consequences. Third and fourth, we must urgently shift to zero carbon electricity and healthy transportation systems in an equitable and just fashion. Fifth, we must strengthen our public health systems to invest in prevention instead of disease. And finally, we must implement a quadruple benefit COVID-19 recovery plan, one that works towards a stable climate, protects public health, promotes a sustainable economy, and creates a more equitable society. That is a prescription for health that any health professional would write and any patient should want to run to go fill. In conclusion, the pandemic and climate change have brought us all together in a shared common destiny, and what binds us is stronger than what divides us. So as we all anxiously await the treatment for the pandemic, a vaccine, let's start implementing the climate treatments that are available and effective today. Let's do it together. Thank you.